Please join me in welcoming our first awardee in this last category, Gopi Gopalakrishnan of World Health Partners.
As we celebrate social entrepreneurs in this forum, I also want to take the opportunity to celebrate those billions of entrepreneurs among the poor who are normally unsung. This can be as simple as a woman by the roadside with a little piece of cloth selling small piles of peanuts. Or it may be a village youth who has rigged up a water pump to a cart to start his own bus service. But in the healthcare space, there is one such entity. These are untrained providers. They are called the informal providers who lack medical and technical skills, but who make up for these shortcomings with an enormous or the fantastic ability to reach out to the community and a fabulous relationship and social skills and business acumen. How do we unleash that energy? The provider you saw in the video, he's typical of the providers we see across the world, across the developing world, especially in the villages where almost 3/4 of the population lives. To use this example, he worked as an assistant to a city-based doctor, picked up some rudimentary skills, came back to his village to become the doctor of the village. This was about 10 years ago. And a couple of years ago, he also invested the required sum of money to join our network. On the one hand, we could convert those rudimentary skills, put him through a training process so those skills can be enhanced. But because he does the consultations the way you saw, and there are also other systems which are coming into force, he's learning constantly, and his skills are improving constantly. And by connecting his rural patient with qualified doctors who are available virtually, his continued learning, he is going to improve the quality of the care he delivers or he will deliver. Because if a family in a village, especially a poor family, if there's someone dying in their family, they may have to sell their little asset, maybe a buffalo or a patch of land, to travel 1,000 kilometers to get care. But for common ailments such as a headache or fever or cough or a child needing treatment for diarrhea, such rural providers are the ones the community turns to as the first stop. And this is even more so in areas where the government programs don't reach. WHP creates viable markets to serve the poor by using existing local skills and combining them with expertise that can be imported into the community with the advantage of the modern age we all live in, such as advances in technology and reference opportunities. But all our programs, as I mentioned in the video, are built for scale. Because we have to balance between the private sector's need to earn a profit with the need for the rural family or the poor family to get the services at a price which is affordable. This is a thin line we have to walk all the time, which enables us to deliver some of these consultations at a price which is as low as 20 cents. But this is possible only if you are able to generate volumes, as all businesses tell us. For volumes, therefore, we have to build scale. So scale for us is an inevitable part. Scale for us is sheer survival tool. I want to address something a little more fundamental here. If there's a young mother in a village who wants to plan a family, but cannot clamber onto a rickety bus to travel some distance to the city to get, say, an IUD contraceptive, we must find ways of addressing that need. If a provider such as the one you saw can make local arrangements and make sure the services can be delivered by inviting providers from outside from time to time instead of being there all the time. Because the logistical arrangement, as most of you program managers would know, is almost 80-90% of the burden. Then that young woman in that village can get a service right outside her doorstep. Okay. After all, if she wants to have 2 children and plans, and she must definitely have the ability to have only those 2 children. She must not suffer the accident of having 10. That's a fundamental right, and we must do everything in our power to protect it and to cherish it. And there are enormous opportunities available outside the traditional systems we are all used to. And that also shows the spirit of entrepreneurship that you're gathered here to honor. And that is something we must tap into and utilize fully to the welfare of all, especially those poorer segments. Thank you.